The bony orbits are hemispherical cavities located bilaterally on the anterior part of the head. The orbits are symmetrical in their location and shape. They hold and protect the eyeballs as well as the nerves, vessels, and muscles that move and supply the eyes. There are 7 bones that form the walls of the orbits: the frontal bone, the sphenoid bone, the zygomatic bone, the maxillary bone, the palatine bone, the lacrimal bone, and the ethmoid bone. There are 4 walls in the orbit: the superior wall, the inferior wall, the lateral wall, and the medial wall. The apex of the orbit is at the posterior side of the orbit. The base is also known as the orbital rim or margin. It's situated anteriorly. The superior wall, also known as the roof of the orbit, is composed of the orbital plate of the frontal bone and the lesser wing of the sphenoid bone in the posterior part. The inferior wall, also known as the floor of the orbit, is composed of the orbital process of the palatine bone, the orbital surface of the maxillary bone, and the zygomatic bone. The components of the lateral wall of the orbit are the zygomatic process of the frontal bone, the greater wing of the sphenoid bone, the orbital surface of the zygomatic bone, and the zygomatic bone. The medial wall is composed of the sphenoid bone, the orbital plate of the ethmoid bone, the frontal process of the maxilla, and the lacrimal bone. There are other structures in the orbital bone, such as fissures, foramens, and depressions. A fissure is a cleft, groove, or sulcus. A foramen is a natural opening or passage through the bone. A depression is a hollow or depressed space that has downward or inward displacement. The optic canal is a tube and is located on the lesser wing of the sphenoid bone. The optic nerve or cranial nerve 2 and the ophthalmic artery travel through the optic canal. The superior orbital fissure is located between the lesser and greater wing of the sphenoid bone. There are 4 cranial nerves that pass through the superior orbital fissure. The trochlear nerve or cranial nerve 4 innervates the superior oblique muscle. The oculomotor nerve, also known as cranial nerve 3, innervates the medial rectus, superior rectus, inferior oblique, and the levator palpebrae muscle. The abducens nerve, cranial nerve 6, innervates the lateral rectus muscle, and the ophthalmic division of the trigeminal nerve, cranial nerve 5-1, provides somatic sensation to forehead, upper eyelid, and nose. This ophthalmic nerve passes through the superior orbital fissure and exits through the supraorbital foramen. The inferior orbital fissure is formed by the sphenoid bone and the maxilla. The maxillary division of the trigeminal nerve or cranial nerve 5-2, the inferior ophthalmic vein and sympathetic nerves travel through the inferior orbital fissure. The infraorbital groove or sulcus is a passage for vessels and the maxillary division of the trigeminal nerve. The infraorbital grooves becomes the infraorbital canal, and posteriorly the maxillary nerve division of the trigeminal nerve exits through the infraorbital foramen, which is located below the infraorbital margin. The supraorbital notch is in the superior margin of the orbit. The lacrimal gland is in the superior lateral side of the orbit. The lacrimal gland produces tears, a watery secretion which serves to moisten the conjunctiva. Tear secretions are slightly alkaline. In the medial wall of the orbit is a small depression where the lacrimal sac lies. From this sac, the tears drain through the lacrimal ducts into the nasal cavity. The supraorbital foramen and the infraorbital foramen are anatomical openings considered possible pathways to the entrance of cancer cells and other infections into the brain or other tissues. Common medical issues related to the orbits are fractures. Fractures usually occur at the orbital rim and bone sutures. The most common fracture to the orbital bones is a blowout fracture. A blowout fracture is a separation of the orbital floor or medial wall caused by a traumatic force or increase in intraorbital pressure. Graves' disease, also known as thyrotoxicosis, is the most common form of thyroid disease, and it is also an autoimmune disorder. Graves is the result of an overactive thyroid gland. An overactive thyroid gland is called hyperthyroidism. Symptoms of Graves cause changes in the body, such as increased heart rate, weight loss, higher body temperature, increased peristalsis, and exophthalmos. Exophthalmos is defined as the protrusion of the eyeball, which can be caused by swelling of tissues around and behind the eyeballs. Exophthalmos can lead to partial blindness and persist even after treatment of Graves' disease. Barbara Bush, former First Lady of the United States, has very pronounced exophthalmos due to Graves' disease. Though Graves can be controlled with medication and surgical removal of thyroid, the condition of enlarged orbital tissues will remain present. Intraocular pressure and exophthalmos resulting from fractures or Graves can damage the orbital muscles and neurovascular structures. Damage to the optic nerve can result in blindness or anopsia, partial visual loss. Damage to the oculomotor nerve can result in external strabismus, the eye turns laterally, ptosis, drooping of the upper eyelids, and double vision. Damage to the trochlear nerve results in double vision and inability to rotate the eye inferolaterally. Damage to the abducens nerve can cause internal strabismus. The eye turns medially. In conclusion, the bony orbits are structures of great significance because they hold and protect one of the most valued senses, the sight. The sight allows people to perceive the world around them, and it is related to higher mental faculties such as memory, learning, cognition. If the bony orbits are compromised, it could lead to increased intraorbital pressure and consequently vision problems.